Imagine a world where your most personal, life-changing decisions are controlled by someone else. Your dreams, your health, and your future are all dictated by laws that don't reflect your voice. This isn't something of fiction. This is something affecting millions of people today. And today I want to show you how your action can help those disadvantaged with reclaiming their right to their reproductive health through our organization, Planned Parenthood of the Pacific Southwest. Although for some of you this is a distant issue, it has the ability to impact those immediately around you, whether it be needing access to contraceptives or needing a medical abortion. It is a right that should be afforded to everyone. We have done extensive research from credible sources on this topic and have realized how dire and urgent this issue is. Our goal is to share this information with you in hopes you'll get involved. Today we'll be showing you how reproductive rights are being disrupted and being made inaccessible to those who desperately need it. We will then show you how to take action, and finally we'll visualize how taking action makes a significant difference.
In these times, action is duly needed, and I'll tell you why. Reproductive rights should be just that, rights. They should be accessible to everyone who needs them. For the female sex especially, access to these reproductive resources is crucial. According to the Center for American Progress, even though 64% of Americans of both parties support a woman's right to abortion, these rights are being thwarted, causing unneeded suffering for many Americans. Due to active efforts on the part of the state and federal government, access to reproductive care that Americans need is being increasingly disrupted, especially in places where women are most vulnerable. Because of this, birth-related mortality is increasing, and so is the financial strain of American families. According to the Kaiser Family Foundation, a public charity, abortion has now been legalized in 13 U.S. states, with only 2 states having imposed laws to protect further rulings denying access to abortion. In times like these, intervention is crucial. According to a study by Amanda Jean Stevenson of Duke University, areas without access to abortion are likely to face an overall increase in pregnancy-related mortality of 21%. For non-Hispanic Black women, the rates climb higher at a 33% increase in birth-related mortality. Because this problem is not being addressed to its fullest extent, the lives of women in our country, a developed, industrialized country, no less, are under threat. Not only are lives being needlessly lost due to a lack of access to important care, but women who make it to term without the means to care financially for a family are being increasingly burdened with rising costs of childcare, which, according to the U.S. Department of Labor and U.S. Census, climbed to as high as a whopping 19,000 inflation-adjusted dollars per year in 2018, about 1/4 of the average household income in the United States. Household, not individual income. With California ranking in the top 10 highest cost for childcare in the United States. Because of these increases in fiscal strain, more and more Americans are choosing not to have children in the first place. Who would, when access to these critical resources, such as abortion and Planned Parenthood, are being actively stopped? According to Planned Parenthood's 2023 annual report, demand at Planned Parenthood health centers for abortion-related care has skyrocketed by 700%, 7 times in the past couple of years, proving that this service is critical right now to women across the country. Universities like Harvard and Duke have published studies estimating higher birth mortality due to lack of abortion. But if that's not enough, let's look at the consequences of these effects. According to a 2021 study by Gabor and Thomas Hadju, based on a case study of a law in Hungary outlawing abortion in a similar manner to the U.S. today, the average citizen without access to critical abortion procedures, average citizen, male or female, faces a roughly 30% chance of becoming unemployed in the same year of the outlawing. Because of this discrepancy, according to Guttmacher Institute, women who are already struggling financially face a higher rate of poverty and addiction, all because of a lack of access to reproductive care that easily could have been solved by allowing this access to everyone.
With that, I imagine you're asking yourself, how do I take action? Well, let's outline some ways to get involved. Planned Parenthood of the Pacific Southwest offers a solution through its holistic reproductive health care services and advocacy efforts. They provide comprehensive care through providing birth control, cancer screenings, STI testing and treatment, and abortion services. They also lobby for policies that protect reproduction rights and for accessible care to underserved communities. Therefore, the best solution would be support our organization and the efforts they are already making through donations, volunteer involvement, and spreading public awareness. The example I'd like to give as to the effectiveness of this is a Guttmacher Institute report, a leader in the fight for women's reproductive rights. has shown that organizations provided with Title X funding have been able to reduce unintended pregnancies and abortion rates in the U.S. Although Planned Parenthood was once a recipient of this funding, it was pulled from them in 2019 due to a rule change by the Trump administration prohibiting providers from discussing or referring patients for abortion services. By providing accessible care, our organization addresses the gap caused by government cuts to reproductive health funding. Their advocacy efforts aim to protect and restore existing policies that safeguard reproductive rights for all individuals, especially women from a lower socioeconomic status. Our plan is to encourage donations, volunteer involvement, and spreading public awareness to expand their resources and operations. Here's how you can do those. Firstly, donations. We like to raise funds to support mobile clinics in underserved areas that will help with accessibility. You can donate via their website at plannedparenthood.org. Secondly, we have volunteering. Getting involved in helping those in clinics where they are short-staffed and allow for longer hours of operation and allow for more patients to be seen. Volunteering opportunities are available for sign-up at the same URL of plannedparenthood.org. And finally, beyond the classroom, posting on social media about the current problems of reproductive rights and encouraging a broader audience to donate and volunteer.
Just hearing how crucial organizations like Planned Parenthood are for women's health, by choosing to act now, you'll actively be making a difference, and I'll explain how. If our speech were to motivate anyone to act, you will be representing the millions of women whose voices were silenced. With your support, many women will have the choice to decide on what she wants to do with their body without fear of being punished. Planned Parenthood will be able to provide affordable care to women when either planning pregnancy or needing abortion. As stated by the American Medical Association, abortion is associated with improved physical health, financial security, aspirational plans, and the ability to take care of future or existing children. If no action is taken today, we're just going to be doomed of repeating history by taking away women's rights that they have fought so hard to achieve. We see from the last term of the Trump administration and how it was their goal to strip the choice a woman has on her body and make it illegal to get an abortion nationwide. According to the National Partnership for Women and Family, if this were to happen, thousands of women would see significant consequences in their lives, mental and physical health, and economic security. With many stripped of having the choice of an abortion, we would see an increase in suicide and depression rates, mostly from rape victims, single mothers, and mothers who are in a low social economic status. The sad thing is, we're already seeing glimpses of this world after this year's election, with many of Donald Trump's supporters taking to social media and mocking and joking about how women's body is their choice. In conclusion, the fact that millions of women are in fear of having their choice stripped away shows how we as a nation fail to protect them, and how we, the one thing we supposedly value above all else, human basic rights. From listening to our speech, we can come to an understanding that women shouldn't have their rights stripped away, but have access to affordable and reproductive care, which Planned Parenthood provides. Many of us wouldn't be here today if it weren't for all the strong women that were in our lives and how much they sacrificed for us. We can start paying back the debt that we owe by fighting for our rights. The time to cause now to act now, before it's too late to fight for women's rights. There are many ways to help by either donating, volunteering, or posting on social media to spread awareness for the cause.
That's it?
Yeah.
Oh, thank you so much. 1, 2, 3. Thank you. This group seemed least cohesive, right? I'm not saying you did a bad job or anything like that. It felt like they were just different speeches and not together. I thought you started really strong, Justice, and I really appreciated that. Then August, you wrote an essay, and then when you make eye contact and talk to us, you are so powerful as a speaker, but you just didn't seem as prepared, and it felt like this wasn't for the people in this audience. It just felt very essay-ish, and I know you have a natural skill that you brought into this class. It was clear from the start. I'm just not sure what you learned from me. I thought, Jaime, you got better, and when you make eye contact, I really genuinely thought you were much improved. You're a big guy, so you should use that to your advantage. You just looked very uncomfortable. So I want all of you to remember, anytime you communicate, there's 3 things you need to be worried about. The words you say, how you say those words, and how you look when you say those words, because all 3 of those codes create meaning in us, if that makes sense. Did you record yourselves?
Yes.
Perfect, thank you so much, have a seat.